Hello and welcome to this channel. In this video, we will talk about multiple pregnancy. Multiple pregnancy, also known as multiple gestation, is characterized by the presence of two or more fetuses in the uterus at the same time. The most common type of multiple pregnancy is a twin pregnancy, but it can also involve higher order multiples such as triplets, quadruplets, or more. When we talk about multiple pregnancies, we usually stumble upon the terms zygosity, chorionisity, and amnionicity. In the next few sentences, I will try to explain what these terms mean and why they are important for us. The first term is zygosity. This refers to the zygote, so the very early beginning of the development of a baby. A zygote is the fertilized egg that contains the genetic information from both the mother and the father. From this point on, usually one baby develops, but sometimes, during the division from 1 to 2 to 4 cells, etc., the cells divide completely and from then on proliferate and develop separately. This is referred to as monozygotic twins. So originally, one ovum and one sperm fused, but they split and now give rise to two genetically identical babies. These twins are called monozygotic as they were originally one zygote. The other scenario concerning zygosity is that one ovum is released from the left ovary and in the same time another ovum is released from the right ovary. Or alternatively, two eggs that are released from the same ovary. In this case, two different spermatocytes fertilize these two eggs and two genetically non-identical twins develop. These twins are called dizygotic as they originate from two different zygotes. The next term is chorionicity. The chorion is a fetal membrane that contributes to the formation of the placenta, and it is the singular or multiple occurrence of these distinct chorionic membranes that determine the chorionicity of a multiple pregnancy. In a monochorionic twin pregnancy, both twins share one placenta essentially. There's more to the chorion than the placenta, but for the clinical significance and simplicity, we can think about chorionicity indicating how many placentas we see in the ultrasound. In a dichorionic twin pregnancy, each baby has its own placenta. Amnionicity refers to how many amniotic sacs are present. In a monoamniotic twin pregnancy, both babies share one amniotic sac, while in a diamniotic twin pregnancy, each baby is surrounded by its own amniotic sac. Important to note is that a dizygotic twin pregnancy results in a dichorionic diamniotic pregnancy, as each baby develops from a separate zygote, and so no structures are shared. Also important is that when there are more than two babies in the same pregnancy, various forms of zygosity, chorionicity, and amnionicity can be present. For example, in the case of triplets, it is possible that two fetuses are monochorionic and share one placenta, and the third baby has its own placenta. The last important thing about those terms is that generally, the later the zygote splits and gives rise to twins, the more structures will be shared. The estimated timeline of these events you can see on the poster. As you can see here also, if a zygote splits after the 12th day, it usually results in conjoined twins. What are risk factors for having a multiple pregnancy? Women over the age of 30 have a higher likelihood of conceiving twins or higher order multiples. Also, having a family history of twins increases the chances of having a multiple pregnancy. Also, having had a multiple pregnancy before increases the risk of having another one. Also, additionally, fertility treatments such as in vitro fertilization increase the likelihood of multiple pregnancies due to the transfer of multiple embryos. What are risks for the babies in a multiple pregnancy? Multiple pregnancies have a higher risk of premature birth and low birth weight compared to singleton pregnancies. Some multiples may experience growth restriction due to limited space in the uterus. Important is also that we talk about a twin-to-twin transfusion syndrome. In some cases of identical twins sharing a placenta, there can be an imbalance in the blood flow, leading to complications. It affects around 10 to 15% of monochorionic twin pregnancies and occurs due to anastomosis on the shared placenta, leading to blood being shunted from one baby to the other. This usually leads to intrauterine growth restriction, dehydration, anemia, and oligohydramnios in the donor baby, and macrosomia, polycythemia, and polyhydramnios in the recipient baby. What are risks for the mother in a multiple pregnancy? Multiple pregnancies increase the risk of developing gestational diabetes and pregnancy-induced hypertension. Also, preterm labor is more common in multiple pregnancy. The risk of postpartum hemorrhage is increased in multiple pregnancy, and the likelihood of delivering by caesarean section is higher in multiple pregnancy compared to singleton pregnancy. We have separate videos to all of those topics in our gynecology playlist if you want to know more about them. How does the pregnancy with multiple babies differ from a singleton pregnancy? A multiple pregnancy is considered a high-risk pregnancy and requires more frequent prenatal care visits. Early on in the pregnancy, we want to determine the status of chorionisity and amnionicity and see how the babies develop. This is especially important to check for in monochorionic twins to assess for the twin-to-twin transfusion syndrome. From the 32nd week of pregnancy on, we usually want to assess the pregnant patient weekly, and we want to assess the fetal growth and obtain a new ultrasound image. How does the delivery of multiple babies differ from a singleton delivery? At first, we want to deliver the baby that is lying closer to the birth canal, or maybe is even engaged already. Before the expulsion of the first baby starts, we want to insert an IV line for the mother to be prepared, in case we need to administer medication at a later point during the delivery. Otherwise, we deliver the first twin in the same way as a singleton delivery. When the umbilical cord is cut, we leave a clamp on the placental side, as there may be an anastomosis with the second twin's circulation. Important concerning the delivery of twins is that we do not administer oxytocin for active management of the third stage of labor before the second twin is delivered, as the medication-induced contraction of the uterus could harm the baby. Between the delivery of the first baby and the second baby, there is a rest period of usually 15 minutes where the mother should not bear down actively. This rest period should not exceed 30 minutes. We can use the phases in between contractions in this rest period to study the presentation of the second twin. Immediately after the delivery of the first twin, an assistant or other doctor should hold the second twin in a vertical position by placing both hands laterally on either side of the uterus. This is done to prevent the baby from assuming a transverse lie, as after its sibling left the uterus, there's now lots of space for the second twin to get comfortable. As we hold the second baby in place, we want to continue to monitor its heart rate. In the event of an abnormal heart rate, we should expedite the delivery of the second twin. In the next step, there are two possible scenarios we should expect. First, if the presentation and the fetal heart rate are normal, we are able to await a spontaneous delivery of the baby and do not have to intervene. Or the second scenario, if the uterine contractions have not resumed after 15 to 30 minutes, we administer an escalating dose of oxytocin to speed up the birth of the second twin by promoting uterine contraction. If the presentation of the second twin is longitudinal, so either cephalic or breech, during the delivery we can proceed as with a normal cephalic or breech delivery. The delivery of the second twin is usually faster, as its sibling has already passed through the birth canal. Important to keep in mind is that there is a significant risk of postpartum hemorrhage due to uterine atony in multiple pregnancy. If there is any doubt that this might be the case, we want to perform a manual removal of the placenta and/or a uterine cavity exploration. If you want to know more about uterine cavity exploration, manual removal of the placenta, or breech extraction delivery, you can see the video in our gynecology playlist. That's it for this video. I hope it was helpful, and if you like our channel, please subscribe. Thank you for watching, and hopefully see you again in the next video.